So intravenous IV devices. So most common one is IV cannulas. There are different type of cannulas. The smallest one is called butterfly set. This set look like the butterfly. It has two wings and one needle. So the wing strapped needle with a metal cannula. This is the cannula with a plastic wings. The needle size is 0.5 to 1.5 inches in length. And with the needle gauge size 16 to 26. So what are the diameter of the opening of the needle we cause gauge? Infiltration of some common with this device as a result of their stiffness, or may be used with children or older client. Those berries are likely to be small, veins are likely to be small or fragile. Older person has a small, fragile. Pediatric children has a small vein. In this picture, you can see plastic cannulas. They have a different size, different length, and different caliber. So used primarily for short-term therapy, especially if the rapid infusion is necessary or more comfortable for the client. Can cause a catheter embolism if the tip of the cannula breaks. Keep in mind, this emboli can cause to develop pulmonary embolism, can cause to develop blood clot in the brain and causes stroke. Next here, so what is IV gauge? The refer to the diameter of the lumen of the needle of or cannula. The smaller the gauge number, the larger the outside diameter of the cannula. This is the opposite. So the size is used depends on what kind of solution, means isotonic, hypertonic, or hypotonic, which solution we use. Or also the diameter is available of the vein. The large diameter lumen allow higher fluid rate than the smaller diameter lumen and allow the administration of higher concentration of solution. For rapid emergency fluid administration or blood product or anesthesia, a large needle, example 14, 16, 18, or 19 gauge are used. For standard IV fluid infusion, we use 20 to 22 gauge needle. If the client has a very small vein, we use 24 to 25. So you see very small vein number increase. But when the vein is bigger or standard, number is going down. Opposite. In the, here showing different IV cannula with different size, different length of needle. And this is the length needle, and this is the caliber or diameter of the needle. So various size of IV needle with over the needle cannulas. IV container. So this is the, you see, tubing. This portion is called spike. And this is the chamber we call drip chamber. This is the roller controller. This is adapter, and this is Y stand or Y side. So IV container, it may be plastic or glasses, this one. Also squeezing the plastic bag to ensure that it is intact. Check the glass bottle for any cracks, or check the solution for any cloudiness or discoloration. The expiration date of IV fluid and all supplies should be checked. Medication should be reconstituted per agency protocol and pharmacy instruction. Do not write on a plastic IV bag with a marking pen, because the ink may be absorbed through the plastic into the solution. Use a label and a ballpoint pen for making the bag or placing the label into the bag. Here showing IV tubing contain a spike end of the bag. This is the spike. Drop chamber or drip chamber. Roller cam. This is the roller cam. Also, this is the key there. You can control how many drops fall per minute, per second. You can do this and control by this key. Y side, this one. Also adapter end. This is adapter end for attachment to the cannula or needle that is inserted into the client vein, or may also contain an area for insertion into the IV palm. Here showing the T stand. It looked like the letter T and two stand. A common question NCLEX board asks: during the blood transfusion, one side should be blood bag, the other side should be normal saline solution, accompanied with blood transfusion, 0.9% sodium chloride, normal saline. So shorter secondary tubing is used for piggyback, right? Shorter one. Which one shorter? This is the longest and shorter one. Connected them to the injection site nearest to the drop chamber. IV tubing continue. The special tubing is used for medication that absorb into the plastic. Also vented or non-vented tubing are available. A vent allows the air or enter the IV container as the fluid leaves, or a vented adapter can be used to add a band to a non-vented IV tubing system. So use a non-vented tubing for flexible container. And sometimes we use the extension of the tubing can be added to a IV tubing set. In here, two picture. This you can see the bigger drop, and here you can see small drops. The bigger drops we call macro drops, and small one we call micro drops. So 1 ml contains 60 micro drops. Drops shortly abbreviation by GTT, and macro drops, it is 10 to 20 GTT. GTT stand for macro drops here. So what is macro drop chamber and micro drop chamber? Macro drip use if the solution is thicker or needle to infusion rapidly or drop factor varies from 10 to 20 GTT per ml. So how we calculate the flow rate? We supposed to calculate the flow rate by a formula. It is called flow rate formula, and unit is GTT per hour. The formula said flow rate equal to the volume of the fluid in ml over the flow rate, duration of the flow. Duration in hour. This is the hour formula. So if question mentioning the minute, we have to follow the different formulas. And drop factors, another formula we use is called drop factor. Varies 10 to 20 GTT per ml, right? And we read the tubing package to determine how many drops per milliliter are delivered, right? Drop factors or drop factor determined by flow rate. Here, micro drop chamber normally has a short vertical and metal space where the drop forms. Deliver about 60 drops. Here, this one we are talking. And read the tubing package, determine how many drops per milliliter are delivered. Same formula we use. We can follow the flow rate formula or drop factor formula. Use if the fluid will be infused at a slow rate, means less than 50 ml per hour, or if the solution contain a potent medication that must be titrated, such as a critical care setting or in the pediatric client. Intravenous device like filters or needleless infusion device or intermittent infusion set we supposed to use. Sometimes we use the filter in that area in here. So filter may be used in IV line to trap the small particles and provide protection by preventing particles from entering in circulation through the vein. Filters are also used for blood administration with neutropenic client. So neutropenia. Needleless infusion device include the plastic cannula or one valve we use. The most commonly in our hospital we use this device. It is called electronic infusion device. So how many drops falling per ml or per minute, it can calculated by this electronic device. It is control the amount of fluid or medication infusion. So check the electronic IV infusion device frequently. As an RN, we have to check it. Although these devices are electronic, This does not ensure that they are infusion solution and medication accurately.